If you think a little indigestion or a few unexplained pounds lost is nothing to worry about after 60, I need you to stop scrolling right now, because what I'm about to share could be the most important 3 minutes you spend this year. In my 35 years as an internist, I've watched pancreatic cancer earn its brutal nickname, America's Silent Killer, because it doesn't announce itself with dramatic pain or obvious warning signs. It whispers. And by the time most people hear that whisper, the 5-year survival rate has already dropped below 13%. But here's what your doctor likely never had time to explain in a rushed 15-minute appointment. There are 8 specific, subtle signals your body sends out long before a diagnosis, plus one simple check you can do tonight in front of your bathroom mirror. I'm Dr. William, and today I'm going to walk you through every single one of them, not to frighten you, but to hand you back the one thing so many of my patients feel they've lost after 60, control. Stay with me until the end, because the third symptom I'm about to describe is the one that fools even experienced physicians, and knowing it could genuinely save your life. Let me tell you why I've spent so much of my career focused on catching this disease early. In 35 years of treating patients, I've sat across from too many families hearing devastating news that in hindsight had quieter warnings, weeks or even months earlier, warnings that were dismissed as just getting older. Pancreatic cancer is particularly cruel because the pancreas sits deep in the abdomen, tucked behind the stomach, which means tumors can grow for a long time before they press on anything that causes noticeable pain. Research from institutions like Johns Hopkins and Mayo Clinic has shown that most pancreatic cancers are caught at a late stage precisely because early symptoms mimic ordinary aging complaints: fatigue, mild digestive upset, a little less appetite than before. I want you to understand this clearly. Your body does not fail you silently. It gives you data. The problem is that after 60, we're conditioned to explain away every ache and change as simply part of getting older, and that's exactly the blind spot this disease exploits. What I'm going to share with you isn't guesswork or fear-mongering. It's a synthesis of decades of clinical pattern recognition and peer-reviewed research, distilled into 8 signals you can actually watch for at home. Aging is not your destiny to lose control over. Knowledge is how you take it back. The first symptom I want you to know is painless jaundice, and I emphasize painless because that's exactly what makes it so deceptive. When a tumor forms in the head of the pancreas, it can press directly against the bile duct, the narrow channel that carries bile from the liver into the intestine. When that duct gets blocked, bile backs up into the bloodstream, and the very first place you'll often see it isn't your skin, it's the whites of your eyes. I always tell my patients to check themselves in natural morning light, standing in front of the bathroom mirror, gently pulling down the lower eyelid, and looking for even the faintest yellow tint where there used to be clean white. No stomach ache, no discomfort, just a quiet color change that far too many people wave off as tiredness or bad sleep. I think often of a patient I'll call Walter, 73 years old, who came in because his daughter noticed his eyes looked off in a family photo. He felt completely fine. That photograph and his daughter's insistence he get checked caught his cancer at a stage where treatment was still possible. The second symptom travels alongside it. Unexplained weight loss of 5% or more of your body weight within 6 months without dieting or increasing exercise. This isn't your metabolism naturally slowing with age. It's what we call cancer cachexia, a metabolic disruption where the tumor essentially hijacks your body's energy use combined with malabsorption, where digestive enzymes can no longer properly break down and absorb the food you eat. For a person who weighs 150 pounds, that's just 7 or 8 pounds an amount. So small, it's often celebrated rather than investigated. Here is your synergy tip. Tonight, step in front of that bathroom mirror in natural light and check your eyes. And this week, step on the scale and write the number down, then check it again in a month. Small, consistent data points are how you catch what your reflection alone might miss. The third symptom is a dull, deep ache that sits high in your upper abdomen, just below the breastbone, and travels straight through to the middle of your back. And the pattern of when it appears matters enormously. Because of where the pancreas sits, wrapped around major nerve bundles deep in the abdominal cavity, a growing tumor can irritate those nerves and produce a pain that tends to worsen after eating, particularly rich or fatty meals, and often intensifies when you're lying flat at night, which is why some of my patients unknowingly start sleeping propped up on extra pillows without ever asking themselves why. What's genuinely useful to know is that this pain often eases when you lean forward or curl slightly, taking pressure off that nerve network, a posture clue most people never think to mention to their doctor because they've simply adapted around it rather than questioning it. The fourth symptom is one that catches even seasoned physicians off guard. New onset type 2 diabetes appearing after age 50, especially in someone with no family history of diabetes and no significant weight gain. To explain it, research out of Mayo Clinic has demonstrated something remarkable here. This kind of sudden onset diabetes can actually precede a pancreatic cancer diagnosis by 6 to 36 months, meaning your blood sugar may be trying to warn you over a year before anything else shows up. The mechanism makes sense once you understand it. A tumor developing in the pancreas can damage or destroy the very cells responsible for producing insulin. So your blood sugar rises not because of years of dietary habits, but because the organ making your insulin is under direct attack. I think of a patient, Eleanor, 68, who was diagnosed with diabetes almost in passing at a routine checkup. She wasn't overweight. Nobody in her family had ever had it. Because her physician thought to ask why now, further imaging was ordered, and her cancer was caught earlier than most. Your synergy tip for this pair: if you've been diagnosed with diabetes after 50 with no clear risk factors, don't just accept the prescription and move on. Ask your doctor directly why now. And if you notice pain that eases when you lean forward after meals, write down exactly when it happens and bring that pattern to your next appointment. The fifth symptom is one my patients almost never bring up on their own, simply because it feels too private to mention, but it's one of the most telling signs your bile flow has become blocked. I'm talking about pale, greasy, floating stools, a condition we call steatorrhea, often paired with urine that turns noticeably dark, almost the color of strong tea. Here's the mechanism. When bile can't flow properly into the intestine because a tumor is obstructing its path, your body can't break down fat the way it should, so that undigested fat ends up in the stool instead, making it float, look greasy, and appear unusually pale or clay-colored. Meanwhile, the bilirubin that should have been excreted through your digestive system backs up and gets filtered out through your kidneys instead, which is what darkens your urine. I always tell my patients, there is no embarrassment in checking the toilet bowl before you flush. This single habit has caught disease earlier than almost any lab tests I can order. The sixth symptom works alongside this: a sudden, sustained loss of appetite paired with early satiety, meaning you feel completely full after just a few bites of food, and this pattern persists for weeks rather than passing in a day or two. This isn't the occasional lighter appetite we all experience. It's a persistent shift where meals you used to finish easily now feel like more than you can manage, often because the tumor is pressing on your stomach or because inflammatory signals from the cancer itself are suppressing your hunger cues directly in the brain. I've had patients describe it simply as food just doesn't interest me anymore, dismissing it as a mood issue, when in fact, their body was sending a very physical signal. Your synergy tip here is simple, but requires a bit of courage. Pay attention next time you're in the bathroom, and if you notice pale, oily, or floating stool alongside darker urine, don't let modesty keep you quiet about it at your next visit. And if you find yourself pushing away plates you used to finish, track it for 2 weeks rather than assuming it will pass on its own. The seventh symptom is one that sends far more people to a dermatologist than to the right specialist. And that's new, persistent itching that shows up with absolutely no rash, no hives, no visible skin change to explain it. The mechanism traces right back to that same blocked bile duct we talked about earlier. When bile can't flow where it's supposed to, bile salts build up in the bloodstream and eventually deposit in the skin, and those salts are intensely irritating to nerve endings just beneath the surface. Patients describe it as an itch that seems to live everywhere and nowhere at once, often worse on the palms and soles, and worse still at night when there's nothing to distract from it. Creams and lotions offer almost no relief because the source of the irritation isn't on the skin at all. It's underneath it in the bloodstream. The eighth symptom is the one I consider the most underappreciated in all of medicine, and it's this: an unexplained blood clot, most commonly a deep vein thrombosis in the leg, presenting as sudden swelling, warmth, and tenderness, usually in just one calf. We have a name for this in medicine: Trousseau syndrome, a classic paraneoplastic sign, meaning it's a distant effect the cancer has on the body, in this case because certain pancreatic tumors release substances that make the blood clot far more readily than it should. What makes this symptom so important is that it can appear months before any digestive symptom shows up at all, arriving seemingly out of nowhere in someone with no history of clotting problems, no recent surgery, no long flight. I want to be clear that a blood clot in the leg is a medical emergency in its own right, regardless of the cause, and it should never wait for a routine appointment. Your synergy tip for this final pair: if you develop itching with no rash that home remedies aren't touching, mention pancreatic and liver function specifically when you see your doctor, rather than just asking about your skin. And if one calf suddenly becomes swollen, warm, or tender, treat that as same-day urgent, not something to monitor for a week. Now, I know that hearing all 8 of these symptoms back to back can feel overwhelming, and I want to pause here and speak very directly to you. I am not telling you that you have pancreatic cancer. The truth is, the vast majority of the time, these symptoms have far more common and far more benign explanations: indigestion, a change in medication, a bout of dehydration, ordinary aging. Itching alone is usually just dry skin. Fatigue alone is usually just fatigue. What matters, what I need you to genuinely hear, is the pattern when 2 or more of these 8 symptoms show up together in the same weeks. That's no longer something to watch and wait on. That's something that earns a same-week appointment, not a someday appointment. And because I know how rushed modern medical visits can feel, I want to hand you a script, 3 exact questions to bring with you so you walk out of that appointment with real answers instead of a pat on the shoulder. Question 1. Should I get a CA 19-9 blood test? This is a tumor marker that, combined with your symptoms, can help guide whether further imaging is warranted. Question 2. Given these specific symptoms, do I need an abdominal MRI or an endoscopic ultrasound? These are the imaging tools that can actually visualize the pancreas in detail, far beyond what a standard exam can tell us. And question 3, especially if you've had recent blood sugar changes, is my new diabetes worth investigating further? Asking these 3 questions by name transforms you from a passive patient into an informed advocate, and doctors respond differently when a patient walks in prepared. Write these 3 questions down right now before you close this video, because good intentions fade, but a note in your phone does not. As we close today, I want to leave you with something I've come to believe more deeply with. Every year I practice medicine, aging with dignity does not mean pretending nothing changes in your body. It means becoming the most informed advocate that body will ever have. You deserve that effort. You deserve to know what your eyes, your skin, your appetite, and even your bathroom habits are quietly trying to tell you, because nobody will ever read those signals as closely as you can, living inside that body every single day. So here are your 3 actions, and I want you to do them tonight, not someday. First, stand in front of your bathroom mirror in natural light and check the whites of your eyes. Second, Write down your current weight and set a reminder to check it again in 1 month. Third, save or write down those 3 questions from this video, and if anything about what you've heard today resonates with a symptom you've been quietly dismissing, book that appointment this week, not when it becomes convenient. If this video gave you back even a small piece of the control that a rushed doctor's visit never had time to offer, I'd ask you to share it with someone you love who's navigating these same years, because sometimes the person who needs to hear this isn't you. It's the person sitting across the table from you at dinner. Comment below and tell me your age and what health concern is on your mind right now. I read every single one, and it shapes the videos I make next. Subscribe if you want medical knowledge that goes deeper than the 6-minute segment on your evening news. I'm Dr. William, and I'll see you in the next video. Until then, take care of yourself. You've earned it.